Ian is unable to be here, so my name's Mel Jacob. I'm Deputy Leader and I'm going to chair this meeting today. So welcome to everybody. If I can just ask people when they're using the microphones to make sure they switch them off when they're not speaking, and hopefully all will run smoothly. I probably have a very different style from Ian, and I'm also conscious that Kate is running a workshop after this. So our aim is to try and get through the agenda. You know, we want to obviously talk about everything on the agenda, but we need to sort of hopefully try and finish this part of the meeting just before 11:30 to allow for a comfort break for those of you who are staying on for the workshop. Thank you. So if we move on to apologies for absence. So we have got Ian Thorne, Mark House, Robert Llewellyn, Naji Darwish, Gordon King, John Hubbard and Lucy Townsend. Any other apologies that anyone is aware of? No. Okay, brilliant. Thank you. So if we move on to item 2, which are the minutes of the last meeting, which was held on the 25th of September and are available on pages 7 to 12 of the agenda. Does anyone have any comments regarding the minutes?
Yeah, so my name is missing from the attendees of the last meeting.
I can only apologise. We'll make sure you're put back in. Are there any other comments or amendments? Oh, omissions. Hopefully you've all checked that you're all on there as well. Okay, brilliant. If there aren't any others, can we move to, we can just make that small amendment and still approve them? Yep. So I move that the minutes are approved. Is there a seconder? Thank you. All in favour? That's sort of everybody, I think. Anybody against? No. And I presume no abstentions. Thank you very much. If we move on to declarations of interest, I now ask board members if they have any declarations of disclosable interest or dispensations to declare to the meeting. And there are none. Thank you very much. So we just move on to Chair's announcements, and there are 2 announcements, and they are in the pack so that you can read them in full. But firstly, just to celebrate really the Carers Together Wiltshire annual report, which reflects the huge amount of hard work that's going on, and that's a really that's there in the pack for you to read. So congratulations on that report and the hard year of work there. And then also following the meeting on the 25th of September, Councillors Thorne and Cape submitted a notice of a motion to the full council on the 21st of October, which was about defending the independent voice of Healthwatch in Wiltshire. And the motion was unanimously approved by full council. So the actions that we're going to take are listed there for you in the pack. It's not in the pack, but it's also important to celebrate that the ICB recently won an HSJ award for the Well Farmers for Wiltshire Neighbourhood Collaborative. So that's a nice piece of happy news. So congratulations on that. Okay, so if we move on to public participation, and we have Mr. Reeves here from the Warminster Area Health and Wellbeing Forum, and he's submitted a paper that you can find in your pack. And I know Mr. Reeves has had an answer, but would like to make a statement about the response that he's had. So welcome, Mr. Reeves.
Yeah, thank you, Chair. It's good to be back here again, but for the wrong reasons, as ever. I just want to thank the board for their previous help with the pharmaceutical needs assessment and in getting the requirement for Warminster and for Corsham in there. Very grateful to the board for their intervention there. Board members will have seen the response in the agenda supplement. Apparently that comes from the ICB. I'm not totally convinced it hasn't just gone through the ICB's hands, but somebody may be able to help me with that. But the majority of responses made in that annex are, I'm afraid, are spurious. We were given, or we were shown, discredited data modelling on cohort location. It is suggested the antisocial behaviour was significant, implying prolonged or frequent. The technical requirements for a mobile unit seem to be unique to Warminster and not necessarily to other locations. the absurd assertion that travelling 4.5 miles with no convenient public transport is easier than a local trip into town, that the petition, signed now by over 850 people, has nothing to do with those affected, and that such a decision was in any way urgent. Sorry, 3 years is not urgent. That could have been discussed before. But I don't want to waste the board's time on that. That's a discussion to have outside this meeting. What I do want to say is that I don't underestimate how disturbing and frightening that one-off incident was for the staff and for the patients involved. But it was dealt with by the local police. This time for the 2025 screening round, within 1 month of us knowing about the relocation, and the first we knew about it was when ladies were being told they had to go to Westbury, the Town Council identified an alternative site with CCTV, with 24-hour security, with convenient parking, and the Town Council agreed to meet the costs of setting up the electricity point needed for the mobile unit. This fact, shared at the meeting, doesn't appear anywhere in the response. Doesn't offer me any reassurance that for the next round in 2028, the same decision won't be made. So my question for the board is the board willing to provide assurances that in future, no decisions will be made on locating mobile breast screening units away from the target population without proper prior consultation and discussion with the relevant town council? And here I'm not just talking about Warminster, although that's obviously my interest. You all live in different towns. If this happens to you, what does that look like? Thank you.
Thank you for your question and your statement. Does anyone want to give a response on that? Caroline?
Thank you. Just to say, we will take those comments back to our colleagues in NHSE who commissioned that service. Thank you.
Okay, I know that's probably not the answer that you want immediately, Mr. Reeves, but I'm sure it will be looked at and someone will come back to you.
To be fair, Chair, it is the answer that I expected.
Yes.
But primarily because the question was put in late, so I do accept that. If I can ask, please, that the Warminster Town Council be the focal point for this. They are the ones, the Councillor Lee is leading on this. I have obviously come in behind this on behalf of the people of Warminster, and I'm grateful for your time this morning, so thank you. And
I might be wrong, but my understanding it's not that it's taking 3 years to make a decision, it's just that it's a 3-year rotation on the...
I think my point, Chair, was that the word urgent used in one of the papers, they knew about this for 3 years, they didn't do anything about it, they didn't talk to the town council, and as a result, we were faced with the population coming back. I have to say, I'm sorry to say, and I'm going to say this, that it was an utterly disrespectful meeting. Town councillors were told that they were representing individuals who just moaned. And at one point, one of the individuals, and it's stunning, turned around and said, well, the women will just have to get used to it. I'm sorry, but that's...
Okay, well, I'm sorry that you've had that experience, and I'm sure someone will get back to you as quickly as possible. Okay, thank you so much for coming along and talking to us. Okay, so I don't think we've got any other members of the public who are here. We don't know anybody else is here. So we will move on to item 6, which is the annual report from the Safeguarding Vulnerable People Partnership. And I believe we've got Richard here to give us a short presentation. Thank you, Richard.
Thank you, Chair. So the full report was circulated with the agenda, and the slide that I'm about to go through were in the supplementary report. So I'll move through them relatively quickly. So a reminder of the purpose of the Safeguarding Vulnerable People Partnership. It's our multi-agency partnership arrangements covering the multi-year arrangements for safeguarding of children, the Safeguarding Adult Board, and the Community Safety Partnership. We've done that jointly in Wiltshire since 2019 to realise the benefits of an all-age and community approach and to work efficiently given the overlap for some of our partners there. Go to the next slide, please, David. Thank you. A list of our key functions there. The legislation varies, so we work with the most rigorous legislation is around the children's legislation, which is what leads to the annual report and the publication of it by the end of September. Next slide, please. So we have a set of priorities until the end of this year, and the report outlines our progress on each of those. If I next slide, David. Thank you. So, some key highlights. The redesign of MARAC, so the Multi-Agency Risk Assessment Conference, looking at safeguarding from perpetrators of domestic abuse. In its redesign, the ownership and operation of that has moved over to Wiltshire Police. There's been the development of an all-age exploitation strategy, the embedding of transitional safeguarding into adult social care. Transitional safeguarding looks at the challenges faced as individuals move from being children into being adults, where services often change. And we now have that embedded into adult social care following a period of work in the Children's Transformation Programme. Walkabout activity, so our walkabouts are multi-agency visits to various different agencies to look at their best practice and offer a kind of a critical eye on areas where they could perhaps improve, but where we can all learn from each other, and we undertook a number of those. The implementation of ICON. ICON is a set of resources around supporting parents when their babies cry. The strap line around that is "Babies cry, you can cope." But we know that that can be a very stressful time, and that messaging has been successfully rolled out through both health visitors, but now also into social care and police as well. We developed a cannabis toolkit, developing a tool around the impact that smoking cannabis has on parenting capacity. That was in response to a previous safeguarding review. And we also piloted the graded care profile 2A, antenatal. That's an NSPCC tool, looks at the risk of neglect, and the NSPCC invited areas to join a pilot of that. So we joined that, working closely with HCRG and the IUH in Bath, and we're now considering if that's something that we want to take up further. Could I have the next slide, David, please? Thank you. Just to run very briefly through each of our priorities then. So domestic abuse. The new domestic abuse strategy has been incorporated into the Community Safety Partnership Strategy, which I know you're going to hear about later. And we've been monitoring our training delivery, both domestic abuse and DASH and MARAC courses, which are provided through the partnership platform. This year, we will be undertaking a repeat referrals to MARAC audit, strengthening the use of data for the behaviour change steering group, and monitoring the impact of MATAC. That's a police-led group, which is the multi-agency tasking and coordination. It looks at those individuals who perhaps don't fit the criteria elsewhere, but still need a kind of a multi-agency view on them. And that started in May. The next slide, David, please. Thank you. In exploitation, as I mentioned, we have the agreement of the strategy, and this year we'll be looking to embed that strategy and monitor its effectiveness. We've linked our partnership leads for children and adults closer to this work, and hoping to improve our links with the wider community safety partnership. And we will benefit from significant work going on within the police as to how they deal with exploitation. And the police provided an update on that in Safeguarding Week, which was last week. Safeguarding unborn babies and under ones. So partners in the ICB worked across Spain, Swindon and Wiltshire to update the pre-birth protocol and the guidance around sudden unexpected death in infancy, with a new pathway and policy published in October. ICON I've already mentioned. We have repeated our 2023 audit and are preparing a report on that around our work with babies and under ones. We'll be monitoring the effectiveness of that new policy and protocol. And again, that's being led by our colleagues in the ICB, and we'll continue to support the ICON rollout. The next slide, please. In transitional safeguarding, as I mentioned, the work was completed under the FACT programme, now sits operationally in adult social care. Ongoing monitoring of that is via both the exploitation groups, children and adults, and the Safeguarding Adult Systems Assurance Group. and there will be new processes for referral in, and we're expecting that to commence shortly. If I can have the next slide, David, thank you. And then social, emotional and mental health are our final priority. We've added pages around the Mental Capacity Act to our website and introduced some training. We will have continued assurance around AWP transformation and now have AWP membership at some of our key subgroups. Next slide, David, thank you. So one of our core functions as a partnership is around case reviews. We've had significant increase in the last few years in referrals for adult reviews and domestic abuse related death reviews. The criteria was changed for those in 2023 and now includes deaths by suicide. We've recently published 2 SAR reports and are awaiting Home Office sign-off of 3 DADA reports, which can then be published. We have 2 further SARs expected early in 2026 and 2 DADAs to be submitted to the Home Office in a similar time. Just to note, this generates a significant amount of work across the system, gathering information for professionals and practitioners to then attend panels, as well as then cascading and trying to embed the learning from those. It also has additional financial implications. So we have a renewed focus this year on embedding the learning to support change and hopefully therefore to reduce the number of reviews that we need to undertake. If I could have the next slide, thank you. Oh, and this is just a graph around the increasing demand in that review space over the last few years, as I've mentioned. So you can see that rise there, particularly in the adult space. That mirrors the national trend as well. And I think that is my final slide, but I'm happy to take any questions either on the presentation or on the report.
Thank you so much. And you went through, you've taken on the challenge of going quite quickly, so hopefully people have had a chance to read the pack and have a look at the report. Has anyone got any comments? Jenny.
Hello. Thank you. The report's really comprehensive, and that slide through there was amazing. I was very impressed. My question is, and it's a bit rogue, and apologise if it's not quite for this. You may be aware that Lady Lansdowne has put together an Ending Violence Against Women and Girls group. It brings together things like the MPs for Wiltshire are in it, Wiltshire and Swindon, the police are part of it, the court systems are part of it, and they're looking at things like how they can help support people with domestic abuse who are going to court, and how to make sure that they don't sort of run into their abusers. Most of our leading charities are part of it, so Fear Free are part of it, the Wiltshire Bobby Van are part of it. The glaring hole is Wiltshire Council. Now, I actually attend that as part of my day job, and I keep being told, oh, she's a member of Wiltshire Council. And I'm like, yes, but I'm not Wiltshire Council. And it's actually been the last meeting we were spoken to by the Domestic Abuse Commissioner, whose name I've completely forgotten, but she heralded it as we are the first place in the country that are trying to bring together kind of all the major players in ending violence against women and girls and really trying to tackle it. We've got, Whitehorse Federation, the school federation are part of it to really try and tackle it at a grassroots level. And I just feel like the one place that's missing is Wiltshire Council. And I just think it might be worth, and it might not be you, it could be someone else, it could be another team, but I think it's a really big part that's missing from there because, if you're not dealing with the police, you're probably dealing with Wiltshire Council if you're in a domestic abuse situation.
Go ahead, Kate.
So I could be wrong, so forgive me, but Public Health are the lead commissioners for the DA for the Fear Free service across the council, and I don't think we've ever received an invitation to be a part of that, but we will absolutely follow up and see if we can get one.
I'm very happy to take that forward and to sort of put you in touch with people who are doing it, because I think it's really important. It's possible that they've just not got to the point where they're kind of, because it's still very in the early concept stages, although Camilla the Queen did turn up to one of their meetings a few weeks ago, just because she lives there, but also it's her passion point. So I just think it's really important that kind of the major authority in the county is also part of it. So I will, if you're all right, I'll take that forward.
Yeah, absolutely agree. And we didn't know about the meeting until after it had happened when Queen Camilla was here.
But if we could also be citing that, because we can then make sure that the relevant, so there is within the Community Safety Partnership is where our statutory domestic abuse local partnership board sits, and there is going to be an additional group, I believe, on violence against women and girls. So I think if we can make sure that that group and the work it's doing are cited there for oversight, that would be wonderful.
Okay, thank you. That sounds like a good connection there. Right.
Sarah, so from Age UK. So obviously we deal with lots of older adults all the time, and particularly people in vulnerable situations. All I want to say is my colleagues, and I was talking to my colleague Kate yesterday, who leads on safeguarding for us, and saying how good Wiltshire is in dealing with safeguarding. We deal across 3 different authorities, and what's really good about Wiltshire is when you have got an issue, because it feels like you're carrying that burden of somebody's safety, is that there is always someone to talk to, always to talk through that issue, that it feels a really positive way of dealing with something before you actually then submit something, and also dealing with things when in a confidential way, that sometimes the relationship we have with that person to keep that going and still reporting it without their consent sometimes is really important, and that, I just want to pass that on. It's a really positive relationship.
Well, thank you. I'll certainly feedback via the executive to our colleagues in adult social care.
That's good. It's always nice to have positive feedback. Claire, did you have your hand?
Yeah, thank you, Chair, and thank you very much for the very helpful report. I just wanted to share a summary of an update that the Chippenham Police reported just a few weeks ago, 17th of October. There was an investigation into suspected modern slavery and human trafficking, which saw 6 people arrested. 7 women were safeguarded following warrants in Chippenham and 4 other towns across the south of England. The investigation began in Chippenham following concerns about the services being offered at a premises in the town. And closure orders were obtained for these 2 premises. The orders are in place for 3 months, and the police will monitor and ensure adherence. Sergeant Jamie Ball in Chippenham said this news should be welcomed by the local community. The important point here, the local community who helped provide information over the course of the investigation. And I know personally that Sergeant Jamie Ball worked with incredible determination to achieve this outcome. But I just wanted to highlight the importance of members of our community in raising awareness of these kinds of incidents. Thank you very much.
Any other comments or questions about the report? Okay, in which case there is a proposal, and I'll read it out. It's recommended that the board note and be aware of how the council works with multi-agency partners to safeguard children, adults and communities, and benefits from a joint approach with shared executive arrangements. Secondly, we note and be assured that the council and partners are discharging statutory duties in regard to case review activity and multi-agency training. And thirdly, that it considers if it requires further detail on any area of the work of the SVPP in future outside of the annual report. So if I propose that, do I have a seconder? Somebody? Thank you. All in favour? I think that's everybody. And anybody against? No, in which case that's, I don't know if it's carried, if it's a recommendation, but off we go. Okay, thank you very much. Thank you, Richard. Thanks for coming along. We now move on to item 7, which is the Wiltshire Community Safety Partnership Strategy and Update, which you'll find on pages 73 to 82 of your pack. And we have Natasha and Sarah here to talk to us. I'm just looking. And so I don't know if you've got a formal presentation or you're just speaking to the report.
Yeah, we've got a very brief presentation. Again, we're aware on your timescales today. So if I can just do a quick introduction of myself. So I am Sarah Valdis. I am the new chair of the CSP executive. I only took over about a month ago, so bear with me. I'm still on a steep learning curve here as well. Supported by Natasha Gell, who is our new community safety partnership manager, who is working across the partnership as well. So employed by Wiltshire Council, but supports the whole of the partnership and particularly the exec. If we move to the next slide then, please. So just as a quick reminder, so the Community Safety Partnership has been around since about 1998, when they were introduced under Section 6 of the Crime and Disorder Act in that year. Each local authority has one. There are around 300 in England and Wales, and they were introduced to bring together local partners to formulate and implement strategic strategies to tackle crime, disorder, antisocial behaviour in their communities. Partners are from all of those 5 responsible authorities, as shown on the slide. If we move to the next slide then, please. So this is just a reminder of what our statutory functions are. So we have to set up a strategic group, which with an agreed structure to work across the partnership. We need a 3-year strategic partnership plan, which has to be refreshed annually to agree our priorities. We need to be analysing via an annual strategic assessment on what the priority areas are, ensuring that we're regularly engaging with the community about their priorities and what we're doing to progress achieving against those priorities. And we have to set up protocols and systems for information sharing. So if we move to the next slide then, please. So the community safety partnership structure is as set out on the screen there. This was agreed yesterday at our CSP exec meeting as our agreed structure that will be part of our plan. So it's slightly tweaked from what might have been in the report. Split us into 3 key theme areas. So our main areas are within protecting vulnerable people, which is safeguarding those at risk, including victims of domestic abuse, child and adult criminal exploitation, with the aim to reduce the number of vulnerable people that are affected by crime and increase support. We then have the reducing harm theme, which looks at minimising impact of crime and disorder from serious violence, substance misuse and serious and organised crime, with the aim to decrease crime rates, particularly violent crime, and a reduction in harm caused by substance misuse. And then the final category is safer communities, which looks at improving safety and wellbeing of the community, including road safety, antisocial behaviour, business and retail crime, rural crime, and violence against women and girls, with the aim to enhance community engagement, increase feelings of safety amongst residents, and create a stronger sense of community cohesion. If we move on to the next slide. So we have our delivery plan for 2025 was particularly around setting up a refresh of the Community Safety Partnership. The partnership hadn't been as effective as we would have liked it to have been. So last year was the key aim was to do a refresh on there. So we've completed a number of actions which were in the delivery plan relating to terms of reference and governance, so making sure that we are set up in the way that we should be. Most importantly, an information sharing protocol has been agreed, and we are now in the process of collecting data from across all the partners. Progress to oversee and deliver the CSP strategy through subgroups has been a key action, so making sure we have those subgroups set up and they are functioning in the right way so that we can adopt the CSP strategy. Reporting progress against agreed to the Public Safety Board, the Health and Wellbeing Board yourself, and also Overview and Scrutiny Boards, which we've completed with coming to you today with the final set of those boards to report to this year. Public meetings to be held per annum. At the moment, the plan is that we are doing those via the existing network of our partners rather than holding a single meeting, which we think may not be as well attended. So making sure that we are capitalising on existing public meetings and what we can do to enhance the understanding of the Community Safety Partnership. But that is an area that we do need to make sure that we do additional work on. Oversight of domestic homicide review and offensive weapons homicide. This is an area that we're doing significant work on in the last year, making sure that the executive understands what their role is in that and that we have full overview of those reports coming to us. An area which is ongoing from the action plan from this year is the strategic assessment of risk to inform and the refresh of the strategy. If we move on to the next slide. Then on that one, this gives us the high level risks that have been looked at. So as you can see from there, we've got our top five crime types within the Wiltshire area and our top 5 issues that have come from the public. So these are the areas that we'll be looking at and making sure are concentrated on within our refresh of our delivery plan. It's important to remember that as the Wiltshire Police recorded the 4th lowest level of crime in the country, so coming out of recent reporting, and there's some data there, as I said, in relating to the number of police reports within county and also within the Swindon Borough area. At this stage, then I'm going to hand over to Natasha, who's going to go on to just a little bit of a slightly more detail onto those 3 theme areas.
Thanks, Sarah. So to give you a little bit more insight into these business areas, in the Safer Communities section of work, we've got the road safety, rural crime, violence against women and girls, and the Safer Communities group. we've done a lot of work in this area to look at the operational groups that sit below this area of business and looking at improvements we can make and how we work together in a better, more efficient way, bringing together different meetings across the county to make sure that we're more joined up at an operational level, and that information then feeds up into these groups that you're seeing on the screen now. Safer Communities Board looks more specifically into things like antisocial behaviour and business crime reduction. We've seen an awful lot of development at the council recently around how we improve reporting around antisocial behaviour, and the Business Crime Reduction Partnership pilot has been established for a number of months now in Salisbury, and we're looking at how we enhance that across the rest of the county. We're also looking at safe spaces and CCTV, doing things like mapping to better understand the volunteer network that props up CCTV across the county. And the Violence Against Women and Girls Partnership Board is a new board that was a recommendation from the review into the Community Safety Partnership. So we'll look to have the first meeting of that in the new year. Next slide, please. In the reducing harm section, we recently had our prevent practitioner move across to the CSP management. Some success in the combating drug space, saw a massive increase and improvement in continuity of care rates, which are now greatly exceed the national average. In the serious violence duty space, thanks to the additional funding that came through from the government for serious violence duty, they've commissioned a number of diversionary courses and programs such as focused deterrence, young futures, and they've also provided training for professionals to increase awareness on things like county lines. As well as Violence Against Women and Girls, the Serious Organised Crime Board is also another one which is newly a new addition to the CSP this year, and again will be having its first meeting in the new year. Next slide, please. Protecting vulnerable people is our final area of business. This includes domestic abuse and exploitation work streams. In exploitation, we split that up into children's and adults, and then we have an all-age exploitation board as well. A lot of that work has been seen an awful lot of renewal recently, thanks to the renewed efforts by Wiltshire Police into restructures and renewal of strategies, which massively impacts the rest of the partnership, as you can imagine. Wiltshire Council have also done an awful lot of work into looking at transitional safeguarding, which is the 18 to 25-year-old space. And we've seen an awful lot of new strategies and products come out in relation to that. And the Domestic Abuse Local Partnership Board is also split into two. So you have the Domestic Abuse Board, which has main focus on victims, and the Behaviour Change Board, which you can see there, has more of a focus on offenders. And I believe
So that's the end of our presentation, and we'll now be open for questions.
Thank you so much for your presentation. A really good presentation, and I just agree. I think at some point, Sarah, you talked about the importance of raising public awareness and raising awareness about the work that you do, and I think that is really key. And Trowbridge is where my ward is, and it's obviously been really positive this summer, the partnership working with Natasha and the police and things to try and move those concerns around antisocial behaviour forward. So I think that's a great model. So I'm looking forward to seeing how it develops. Does anybody have any questions for Sarah and Natasha or comments? Go ahead.
Hi, I'm Kev. I'm from Care Forum. We're an organisation that runs Health Watch Wiltshire in Wiltshire. I guess an offer around comms. Happy if Health Watch can support the promotion of the work that is being achieved. Happy to be involved with that. I'm interested in the statistics from the Combating Drugs Board around prison leavers, which is a really good improvement on prison leavers remaining in treatment post release. And I guess it'd be really interesting to have an ongoing conversation about how that figure can be improved year on year. If we think about people on drug and alcohol treatment in prison, actually it should be 100% of people leave prison and remain in treatment. And we know it's a protective factor, not just for those individuals, but if we look at the other work that you're involved with around domestic violence, it's a protective factor for for women and children as well. So just really interested in that statistic to understand how that improvement was made, and and to see if there are any areas where more improvements can be made. Thank you, Chair.
Yeah, I can absolutely go back to Combating Drugs Board and ask for more detail.
I'm sat smiling at Natasha. So I chair the Combating Drugs Partnership, the partnership is so very key in changing any of these indicators. And you'll be aware that any kind of pathway from somebody leaving prison to come out into the community is very complex, is sometimes at very short notice, and can sometimes happen in ways that make that very challenging. So it is absolutely a core focus, and our prisons are really well engaged with the Combating Drugs Partnership to help support that. There's also a really good relationship with probation as well. So I'd be really happy. I can contact you after the meeting and give you more detail. But we're really proud of the partnership that we have, and we always want to be the best in every indicator. I don't think we're there yet on all the indicators, but we're getting there.
Okay, go ahead.
Really helpful report and presentation. Thank you. Just wanted to ask about cyber-enabled crime. So you've identified it as an issue, and I'm wondering what happens locally versus what happens nationally, because I know it's a really real challenge. What's the role of the partnership within that area?
So cyber-enabled crime is actually managed nationally rather than locally. One thing that probably might impact your constituents more is fraud, and the fraud management group that the police run is going to be part of the new SOC board. So that's going to all fall into the serious organised crime. Yeah.
Okay, thank you. Any further questions or comments? No. Let's see. Okay, so we're just noting the report. So if I propose that we note the report, do I have a seconder? Somebody has to second, because otherwise we can't do it. Yeah, thank you very much. All in favour? Oh, go. Yeah, okay, that's everybody. Great, thank you very much. And good luck. That's a big list of things to sort out. Good luck in your new role, Sarah. Okay, so if we now move on to item 8, which is the Joint Strategic Needs Assessment for 2025, which is on pages 83 to 88 of your packs. And we've got Mike, and I haven't got your name down here, sorry.
Good morning, sorry, my name's Nikki Murch.
And Nikki to talk to us about this. Thank you.
Morning, everyone. So, I'm Mike Rose, Public Health Principal for Intelligence and Wider Determinants, here to talk about the Joint Strategic Needs Assessment, which is hot off the press, published on Tuesday. Claire, I'd like to invite you in. Did you have a few words that you wanted to kind of say before we started at all, as our Cabinet member?
I just wanted to say thank you very much for the extraordinary level of work that's gone into this. It's very valuable evidence, and I look forward to this board making good use of it. Thank you very much.
No, thank you very much. If we go on to the next slide, please, that'd be helpful. Good. So I'm just going to start with a bit of an overview about the JSNA, what it is and why we've done it. So the JSNA is a strategic resource which summarises the current and future health needs of Wiltshire. It's a statutory document that all local authorities must have, and it's used to inform local evidence-based planning, decision-making to improve health and wellbeing overall, and just as importantly, more importantly, address health inequalities in those strategic plans. So it's produced by Public Health Intelligence, spearheaded by Nikki on my right, and a team of public health scientists and analysts that gather data, download the data, and go through the process of producing the document over what can take up to around approximately a year to do. So it's a large document. It takes a lot of time to put together such a valuable resource. So in terms of how often it's refreshed, it's every 3 years. So it was last published in December 2022. And you'll see in the bottom left of this slide, this is located on our strategic evidence base of the Wiltshire Intelligence website. So you can find the link for that on this slide and also in the accompanying paper. So many of you who have access to the website will see that there's a host of different resources, strategic documents, for example, public health needs assessments, surveys, things like the census dashboard. And one thing that is on there is the community area JSNA. So what I'm going to do now is probably set the world record for how many times JSNA is said in the space of 1 minute. But let me know how I get on, and hopefully it's clear. But these are two separate documents. So the community area JSNA, which was last published back in 2023, February 2023, focuses on the 18 community area boards across Wiltshire. So the purpose of that document is to primarily support area board priority planning and local strategic planning from those community areas. It does look at a number of health indicators, much of which is influenced by the health and wellbeing JSNA, which is what we're talking about today. And there are some indicators within that document that go outside of health. But today, we're talking about the health and wellbeing JSNA, that statutory document. So, in terms of what the document itself is doing, so it's summarising over 200 indicators across 6 different chapters that you can see at the top right hand of that screen. And Nikki is going to talk through some of those key components, but just to kind of broadly summarise, data is presented through largely trend-based tables, interactive charts, and also some narratives that kind of provide some context to each table just to make things as clear as possible to those that are reading it. There's also 2 different sets of infographics that we produced this time. Back in 2022, we produced infographics just around the chapters, but this year we've taken a slightly different approach, taken on feedback from the previous edition, where we're looking to do, yes, the infographics for those key chapters that you see at the top right, but also a different set of infographics that summarise the key findings across the life course. So we're hoping that the board find these useful, and also in terms of the people that are reading the documents, you see that as an accessible way. And we'd be interested to hear any feedback on those infographics. It's fairly clear as to which one's which, as Nikki will show in a minute. The green ones are on the main themes that you see at the top right, is in the main chapters, and then the purple ones are the different infographics, the data sets across the life course. So I think that's all I need to say on the JSNA as a general overview. I know many of you are familiar with the document, having been part of the board for a number of years, but I'm going to hand over to Nikki now, who's going to take us through some of those specific components and data. So over to you, Nikki. Thank you.
Thanks, Mike. Good morning, everybody. My name is Nikki Murch, and I'm manager of the Public Health Intelligence team, and we are the team that have produced the 2025 Health and Wellbeing JSNA for Wiltshire. So I'm going to take you through the rest of the slides here, starting with how you can find the JSNA and also how you can use the website charts and tables. So the JSNA is hosted on the Wiltshire Intelligence website, and the address for this is shown at the top of this slide. You can navigate to the JSNA when you're on the homepage by selecting the JSNA option that appears here. When you click on this will take you through to a page that will present you with 6 themes. Clicking on one of the themes will allow you to access the data, and you'll see an image, hopefully, that looks very similar to the one that's presented here. So the format that's used for the indicators is the same across all the data that's presented within each theme. So you'll see some descriptive commentary at the top, and this is provided by way of context. It also provides some explanation of the relevant trends. You'll see some kind of data visualization in the middle, and these are largely interactive charts and tables. And at the bottom for each indicator, you'll be able to see the data definitions, the data sources, and the timeframes used that the data pertains to. If I could have the next slide, please. Thank you. So a lot of the charts that we've used this time are interactive. So I'm just going to explain some of the functionality that's available now. So if you click on the top 3 lines on the that appear in the top right-hand corner of the chart, this will allow you to download either an image of the chart, should you want to use this in any other documents, for example. And there's also the facility to download the data that's used to inform the chart. Also, if you hover your mouse over any area of the chart itself, this will bring up a tooltip, which is what you can see hopefully in the image here, and this will show the data labels, so you can see the data values that are used on the charts. And the legends that we've used at the bottom of the charts are also interactive, so that you can turn items on and off, and this will change the information that's presented in the chart. So on this example, we're looking at a 5-year period. If you just wanted to look at data for 2023-24, for example, you could just deselect all the years that you're not interested in, and this would change the information that's shown on the chart. If I could have the next slide, please. There are a number of tables that are also used in the JSNA, and a lot of these are also interactive, and the functionality for these are slightly different. So you can use the options in the top right-hand side of the table to either copy the table, again, for use in other documents or presentations, and there's also the facility here to download the data either as an Excel or a CSV file. The tables are fully searchable, so you can use the search facility on the right-hand side of at the top of the table or at the bottom to search for specific items. So if you were, in this example, if you're interested in looking at hypertension, for example, you could type that into the search facility and the table would change just to present information for that condition. The tables are also fully sortable, if that's a word, and you can use is now, and you can use the, if you click on the column headers, it will present you with an arrow and you can sort the data, largest to smallest values or vice versa. So in this example, the data is currently presented alphabetically, but if you click on the column headers, it will allow you to sort the data if you wanted to see them presented in numerical values. A guide to help users navigate the JSNA website and also explore some of these areas of functionality in more detail will also hopefully soon be available on the Wiltshire Intelligence website. If I could have the next slide, please. So as Mike said, there are two sets of infographic summaries that are provided as part of the 2025 JSNA. The first are summarised by theme, so there's one of these for each of the 6 themes. These are presented in green and you can access these at the top of each thematic web page. So the example that we're looking at here is the summary from the population and deprivation section. So this summarises key information relating to our population and also population projection information. If I could go to the next slide, please. This slide also summarises information relating to some of the key population health groups that we have in Wiltshire, including, for example, our prison population, our Gypsy, Roma, boater and traveller communities, and also our military personnel, for example. If I could have the next slide, please. So the second set of infographics are provided by Life Stage. So these highlight key focus areas drawn from across all of the 6 themes in relation to different life stages. So there's 3 of these. The first one looks at starting well, so this very much focuses on children and young people. There's one for living well, which focuses on adults of working age, and there's one for aging well, which is the example that we can see here, which looks at our population aged 65 years and over. These are denoted in purple, and you can access these towards the bottom of the JSNA homepage under the heading Cross-Cutting Summaries. If I could have the next slide, please. Apologies for the wordiness of this slide. What are the key issues? So hopefully, as I've just briefly outlined, a lot of the key focus areas are highlighted in the infographic summaries by both theme and life stage. But very briefly, some of the key issues in terms of each theme are, starting with the population. Wiltshire's population is ageing, so by 2045 our population aged 65 years and over will have increased by 40%. This is equivalent to about 47,500 people, so it's very important that as an organisation we're planning for this and we're equipped to deal with the challenges that this will present. In terms of life expectancy in Wiltshire is higher than England, and this has been the case for some time. But people living in more deprived areas have significantly shorter life expectancy than people living in other areas of the county, and therefore this presents a significant health inequality. In terms of health and disease, the most prevalent health conditions that we have in Wiltshire, which are hypertension and diabetes, are heavily influenced by modifiable lifestyle factors such as smoking, diet and physical activity. So sensitive promotion of healthy lifestyle behaviours will continue to be a priority for certainly the public health team. So very much linked to this in terms of lifestyle and risk factors. So just to sort of link back to some of the factors that I've just mentioned. So for adults in Wiltshire, it's estimated that 10% currently smoke, 60% are overweight or obese, and around a quarter of people are not undertaking recommended levels of physical activity. In terms of housing crime and the environment, there are a number of health inequalities here. I'm just going to draw attention to a couple of them. So firstly is fuel poverty. So nearly 1 in 10 households in Wiltshire is experiencing fuel poverty. And this means that household members cannot afford to adequately heat their home. In 2023-24, there were just over 1,500 households in the county that were either at risk of or experiencing homelessness, and this is likely reflective of the current socio-economic climate. Moving on to the last one, which is education and employment. What we're seeing is the proportion of pupils that are known to be eligible for free school meals is increasing, and this is likely to grow further with the extension of eligibility from the 2026 school year. We're also seeing increased numbers of pupils in Wiltshire with identified special educational needs. So really what we're seeing is growing numbers of specific pupil population groups with very different but very distinct support needs, and we need to make sure that we are equipped to address and support these. There are a number of underlying challenges that run through all of these themes, but the two big ones that I just want to mention are cost of living. So as you are all completely aware of, we're living in increasingly financially challenging times, and we're seeing more people in the county that are experiencing some form of financial hardship. The second one is health inequalities. So what we are hoping is that as you look through the information that's held on the website and also the infographic summaries, the analysts have tried where it's evident in the data to highlight health inequalities. So it's imperative that we continue to address these health inequalities where we know they exist going forward. The last little thing that I want to mention relates to deprivation information. So for anybody that has looked at the JSNA, you'll notice that the deprivation information included in the JSNA is currently very limited. And the reason for this is because the indices of multiple deprivation, which is the national data set that informs our understanding of deprivation, which is not very easy to say, was updated at the beginning of November, just as the JSNA was nearing completion. So this is published on average about every 5 years by the Ministry of Housing, Communities and Local Government. It's a very big, complex data set. So following publication of the JSNA, the Public Health Intelligence team will be working to make sure that we understand it, and we'll be also working to produce a number of guides and resources to assist with interpretation and application. The other thing that we will be doing is retrofitting retrofitting information in relation to deprivation indicators that are currently missing from the JSNA as and when they're made available to us through our open source data sets. And we hope to do this in early January 2026. So that's it from me, and it's probably enough about data for a Thursday morning. So I will just hand back to Mike quickly for some closing comments.
Yeah, no, thank you very much, Nikki. I would also like just to express my thank you to Nikki, and well done to the Public Health Intelligence team, of which some are online. I was going to say they're all asleep from doing such a huge document, but I think they might have got up. But yeah, it's been a huge piece of work, and we're really proud. And I think the next steps for us are certainly we would like to ask for the board's sign off for this document. And I think secondly, I'd also like for the opportunity to come back and perhaps do a deeper dive into some of these themes that Nikki talked about as some kind of workshop, because it is a lot. And I know Nikki did a grand job of doing that in such a short space of time, but there's so much more that we can do to kind of drive these findings forward. And if there's time, Chair, please, any questions and reflections, we'd be grateful. Thank you.
Thank you so much for the report. I mean, actually, it is so interesting that I just want to scrap the rest of the agenda and just spend time looking at that. So I think you're absolutely right. It would be really good to be able to come back and do a deep dive into it. I felt slightly alarmed and distracted at the first slide that Wiltshire was doing so much worse on that list of illnesses than everybody else in England. While it's a fantastic resource, but slightly depressing. So, but although motivating for us all to go out and make sure that we move Wiltshire in the right direction in many areas. So I don't know if anyone else has got comments or questions. Caroline?
Well done for a start. It's a brilliant piece of work, and you can see you can see the challenges facing us, can't you? And I think one of the critical points for us is to link it to the conversations that we'll be having after the break around neighbourhood health, and just how some of this information can really support us to think about not just the kind of the macro Wiltshire level, but also at those neighbourhood levels, and what's the experience of people in their very local communities. But you're right, there was some alarming statistics there, weren't there, particularly in terms of our ageing population, which we shouldn't be surprised about, because we know that that is happening. But again, to see that reinforced, I think is obviously something that we really need to respond to. But it looks a fantastic resource, and yes, just huge thank you, really.
Thanks, Caroline. I'll come over to you.
Hi everyone, I'm Tony Mears. For those of you who don't know, I'm the Deputy Director of Strategy at Salisbury. Thank you so much. I've been excited for an entire quarter since this was trailed as going to be at this meeting. I definitely think once the new data is in, ICB and acute colleagues and probably others would be very interested in an updated briefing, and that would be really interesting. I haven't had a chance to look at the national drop from earlier in the month. Do you have a sense that any of the core 20 areas will be different, be the same, have got worse within them from what you might have glanced at already, or might not be there?
So from a very, very quick glance at the data, I think broadly our areas are still the same, but to what extent and how the levels of deprivation have changed, I can't really comment on yet, because I've not really had a chance to look at the data. But I do know that there has been some quite significant changes to the methodologies used. So that's what the team will be focusing on understanding. So as soon as we've got something ready to go, we'll be more than happy to share it.
Thank you. I really enjoyed reading that. Nick Ware, sorry, GP in North Wiltshire. Can I just ask a technical thing? I think I've read something which is a statistic better than I hoped, but I may have misread it. Nearly 3/4 of population are undertaking recommended levels, or are not?
Yeah, so I just flipped it. So on the slide it says
I have read it
3/4 of the
correctly.
people
So actually,
are,
that came across, although it's not
Yeah.
great, it's actually better than I feared sitting in my consulting room every day. So
yeah,
thank you.
yeah.
So thank you for highlighting the positives, which is good. Kate, do you want to come in?
Yeah, I mean, people may accuse me of being biased, because I used to oversee the intelligence team in the production of the JSNA, and I love this. And I just wanted to assure the board, the team worked really hard after the last publication to make sure that it was taken to the right places where commissioners were sitting, where providers were present, and to do it in such a way that it was done through story. Because although some of us absolutely love charts and data, it's maybe not for everybody. Again, with this time around, the team have already committed to be doing a specific workshop for the Health Select Committee and the Council, very much linking what we're seeing in here to the 10-year NHS Forward View plan. So there's different ways that we can look at supporting partnerships across the system, and the team will do that with great enthusiasm. And yeah, a huge thank you to me, because you've no idea. I mean, you know, the team for the whole year, it's all they do, and I don't know how they keep going and doing it.
No, I mean, it does look amazing. That's what I'm saying. I feel like I need to have a chance to have a go and then have a chance to have a discussion afterwards. But it does look very accessible, and yeah, no, definitely. Claire.
Sorry, do you want to give them? Okay, no. I just wanted to add my thanks. It's an extraordinary piece of work. Obviously, from what Kate said, you've worked really hard, and I know that to be true as well. I think the point, not so much a question, the point I wanted to make, this valuable evidence is relevant across the entire council. So I would just really say a shout out to your team for information and evidence that the entire council should be accessing and making use of. The emphasis on cost of living, we know that to be true. Health inequality is something very dear to my heart. And really a shout out for the presentation of the data and the analysis. I think, again, that's something that the rest of the council could potentially learn from. Caroline mentioned about neighbourhood health. Absolutely, this is exactly the sort of information we need to ensure that the neighbourhood health model goes forward and works well, and informs personalised care that can sometimes be in name but not in reality unless we're really careful. So thank you.
I'm just wondering, Claire, whether you think we could invite Mike and Nikki to present at Cabinet Liaison. That might be really useful. Sorry. But I think it's really important that all the Cabinet are aware of the data, because it should impact on every decision making, whether it's highways or, you know, the more obvious ones. Hopefully you'd like to accept that invitation.
No, definitely.
If you can spare half an hour to do that, I think it would be extraordinarily valuable. So if you would accept, that would be great.
No, we will certainly accept that, and I know I speak on behalf of the team that we're looking the document. Given, you know, it's a huge amount of work, but it's very much at the beginning to get it out and ensure that it's being used across the system is a you know, it's key. And I think just picking up what you said, Claire, in terms of data analysis and all of the bits that they do behind the scenes is very complex. But what I would say about this team is their ability to communicate it. If you just seen with Nikki, it's a completely different skill, but something that they've got in abundance, and we've heard, you know, across the council much wider in terms of how these things are presented, in terms of the slide colours, for example, the different infographics and how they put together. It takes a long time, and it's to their credit. And I think, you know, in terms of driving that across the council, I think Heads of Service Forum is certainly something that we'll go to, and any other opportunities that we can get our hands on, we will certainly be there. So thank you.
Brilliant, thank you. Sarah.
Thank you. I mean, I use data like this all the time when I'm doing funding bids, and it's really helpful to have that narrative too in the interpretation, because when you're sitting looking at something and you think, well, what is this actually telling me that I need to be able to make sure it's in the funding bid? That'd be really helpful. I think also when we're designing our strategy about where we're going to do and where we're going to emphasise our work, it's really helpful to know some of that. You're getting lots of invitations now to other things, but I think the presentation to the VCSE leadership team would be great to do that, and I'll make sure that somebody gets in touch about doing that, because it'd be really helpful to do something at one of those things. But the other part is too, and I've done a lot of tours of area boards recently for various things, and lots of area boards are looking at their strategies, and I'm not sure that every councillor that sat around those area boards really has looked at the data of what's affecting them, and particularly new councillors now are just starting to come on board and think, oh, what's this? And I can give figures about what happens locally in their areas, but also I think this would be really helpful to area boards and to councillors to understand their own patch when they go. And then the new stuff that's obviously going to be published, well, it has been published, but interpreted that's coming from government would be really helpful. My one last final thing though is data is data, and sometimes we get wrapped up in the highest areas of deprivation or something, but there is still deprivation in those small areas of those same people, and you're still trying to meet the needs of those people. So when we look at the data, let's not just forget the people who also, you know, you might have Headington, for instance, being a really nice, lovely place, lots of positivity, but there are several people living in that community who are living on the borderline and actually further away from services and support. So it's just thinking about how do we reach those people too when we're looking at provision. That's more to, not to you, that's more to people who commission things.
Thank you for that, and I think thank you for your pointing out the area boards, because you're absolutely right. The area boards really do need to. They do reference it, but whether they actually sit and listen to someone explaining it to them. So, well, I'll mention that we maybe try and get that on the list. You start charging for your attendance, and you'll be fine. Jenny.
You've probably just sort of said what I was going to say. As one of those new councillors who does sit on an area board, I think it'd be really useful for you to come to it. I also represent an area which is a very strange division. I have the third highest area of deprivation in Wiltshire in my division. I also have one of the most expensive streets to live in my town, in my area. It's a really strange place, and I live in that and Sarah's one of my residents. I think for me it'd be really helpful as a councillor who's then going forward and trying to, you know, take these things forward and these policies forward, and obviously also being the portfolio holder for adult social care. It's really helpful to be able to really drill down into this data, and also I really can't thank you enough for those graphics, because data's my jam, but actually interpreting data is the thing that I love the most. So thank you, because it's brilliant. And I was just getting very excited by my own area board stuff. But kind of one of the things is that my area board is there are these pockets of deprivation in Wiltshire that are very, very deprived, like my area in Melksham Forest. And yet the data can get skewed by the fact that there are also very lovely areas. So it's just making sure that those areas that are lovely, we're also capturing the people who are missing in those areas as well. Because everyone sort of knows that Melksham Forest is deprived, but don't necessarily know that there's deprivation in Steep Ashton.
Great, thank you. Any other comments or points? You've created yourself a nice long list of work to do there, but I think that's a sign of success. So thank you again. So I would just like to move the following recommendation, that as a board we approve and sign off the Joint Strategic Needs Assessment 2025. We endorse the structure and content of the JSNA 2025, and we support the continued engagement with partners to ensure that the JSNA informs strategic planning and commissioning. So I have to ask for a seconder again. Thank you. Oh, there are lots of seconders. Everyone likes this one. Everyone in favour? Thank you. That's everybody, I think. Thank you so much for coming along. We now move on to item 9, which is the annual health protection report 24-25, which is in your pack on pages 89 to 132. And we've got Emily and Alice, I think, yes, to take us through this. Thank you.
Thank you. I'd firstly just like to invite our Cabinet Member, Councillor Cape, to just introduce the report today.
Thank you very much. I'm very pleased to introduce the annual health protection report for 24 to 25. This is a statutory document produced on behalf of the Health Protection Assurance Group, a multi-agency partnership with the remit of providing assurance to the Health and Wellbeing Board that systems and measures are in place to protect the public's health from threats and hazards, and summarises the year in health protection. Health protection is the protection of individuals, groups and populations through expert advice and effective collaboration to identify, prevent and mitigate the impacts of infectious diseases and environmental, chemical and radiological threats. As noted in the foreword of the document, effective health protection depends on strong partnerships and collaboration. Assurance of health protection arrangements for Wiltshire is part of the statutory role of the Director of Public Health. As is a technical paper, questions will be taken by the lead officers. The Health and Wellbeing Board is asked to note and acknowledge the Wiltshire Health Protection Assurance Group's annual report and to support the recommendations made within it for the Health Protection Assurance Group to take forward. I'd like to introduce Alice Marriott, Public Health Principal, who will give the presentation. Thank you.
Thank you, Claire. As introduced, we're going to present the summary of the health protection report today, and reflecting, as we've said, the work of the Wiltshire Health Protection Assurance Group, which is multi-agency and also just involving colleagues as well from across the health protection system, but also Wiltshire Council colleagues as well from different directorates. We do aim to provide assurance to Health and Wellbeing Board that systems and measures are in place to protect the public's health and of course our residents. Just a note on the reporting period going forwards, we'll be basing this on financial year to reflect a lot of the health data that we receive rather than calendar year. So the report that you've received includes data from the last quarter of the previous financial year, just to bridge this change. Next slide, please. Thank you. So briefly, the report is structured into 2 sections. We have the introduction, background and executive summary, and then following this, an assurance review, which is themed around 6 domains which have been identified within the current health protection strategy. Those are infection prevention and control, immunisations, environmental hazards to health, screening, communicable diseases, and health emergency preparedness, resilience and response. Thank you. And in the report, we felt it's important also to outline the sort of global and national context in which the health protection report is existing, particularly related obviously to health protection to really aid the framing of the information presented. So throughout 24 and into 2025, we have seen vast displacement globally, with conflict being a major contributor to this. We've seen changes announced to the health system in this country, with key partners such as integrated care boards and NHS England affected. The ongoing climate emergency is something we touch on in this report, particularly around its effect on health. And we've also seen infectious diseases such as mpox and measles rising. The introduction of a new RSV vaccination has resulted already in a 30% reduction in RSV hospitalisations in older adults, and we look forward to further data on that as we go forward, but really demonstrating the continued public health importance of vaccination, and a positive story there amongst some of those slightly gloomier ones. Next slide, please. Thank you. So the assurance part of the report has been divided into 3 pillars: advocate, act and assure, as represented on the screen. And these really reflect the Health Protection Assurance Group and the Director of Public Health role within the system and within that health protection system. So I'll now pass over to Emily, our Public Health Specialist in Health Protection, who's going to run through some of the examples from those strategic pillars that are presented within the report.
Great, thank you. So advocating for the health needs of Wiltshire's population is a key role of the Health Protection Assurance Group. An example of an advocate recommendation within the report is to develop a Wiltshire-focused childhood vaccination action plan. So Wiltshire generally has good vaccine uptake, but some fall below the World Health Organisation's 95% target, and there are pockets of low coverage and inequalities faced by communities in our population. In 2024, we commissioned Healthwatch Wiltshire to explore the local attitudes to vaccination, prompted by rising vaccine preventable disease and growing hesitancy post-COVID. And we know that national rates were at a 10-year low. So we'll use these local insights to develop a system-wide plan through the Wiltshire Immunisation Group Partnership. And this plan will include targeted actions to address population needs, reduce vaccine-related inequalities and maintain that generally high uptake and improve coverage in areas where it's low. Next slide, please. Under the ACT heading, we focus on areas where evidence shows a need for system-wide action, so this could be preventative or responsive to protect public health. An example of this is tackling gram-negative bloodstream infections, which are serious invasive conditions and the most common healthcare-associated infection in Wiltshire. Most gram-negative bloodstream infections in Wiltshire originate in the community, so a whole system approach is needed, utilising the system working groups such as the BSW Infection Control Collaborative, and working with a range of partners, including adult social care, community health providers and the voluntary sector, to ensure interventions will be tailored to Wiltshire's geography and affected populations. Next slide, please. Increasing sexually transmitted infection testing across Wiltshire is a key priority to improve early detection and inform effective interventions. So current evidence shows that STI diagnoses are significantly lower than the national and regional averages, likely due to low testing rates. To address this, the report recommends a sexual health needs assessment, including a review of testing practices to shape a comprehensive testing strategy. This strategy will explore innovative initiatives to improve testing rates and provide a clearer picture of the true STI burden, which will be fed through the Sexual Health Partnership Board and ensure services are accessible, effective and responsive to local needs. Next slide, please. So finally, recommendations under Assure reflect the Director of Public Health's statutory role in providing strategic leadership and oversight for health protection. Strong system working is vital to enable us to horizon scan for emerging risks and respond effectively, ensuring appropriate partners are engaged when needed. A recent example was our work to ensure system readiness in case of a local increase in measles following the national surge. With major system changes expected, including those ICB cuts and clustering, NHSE disbanding and commissioning responsibilities shifting for vaccines and screening, assurance is critical to maintain a robust, responsive health protection system. Work is also underway to develop a regional health protection memorandum of understanding, which aims to strengthen the effectiveness of health protection by ensuring clarity in roles and responsibilities across the system. This will support other key assurance mechanisms such as a local health resilience partnerships communicable disease plan and our system involvement in exercises, including the National Pandemic Preparedness Exercise, Exercise Pegasus. Next slide, please. So to summarise, our request from the board is to acknowledge the Wiltshire Health Protection Assurance Group annual report and support the recommendations set out in this. We will then ensure that these recommendations are integrated into the Health Protection Strategy Implementation Plan to monitor progress and initiate action or collaboration where this is required. This will be fed into the Health Protection Assurance Group to ensure focus is retained on the delivery of the health protection strategy, and will also begin work on the development of the refreshed strategy due during 2026. So thank you for your time, and I'll hand back to the chair.
Thank you so much. And again, there's probably another 3 hours of conversation to be had about this, but we haven't got that. So that's fantastic. Thank you so much for your report. I spent 20 years working in and out of schools, so I spent a lot of time thinking about vaccinations and things. It's quite interesting to understand why people decide not to go ahead with vaccinations. I think quite often they're just inadequate at filling in the form. Sadly, some of the cases, not always. So does anybody have any other comments or questions? Was that you, Jenny? Were you just, no, you weren't. Caroline.
No, I was just going to say, excuse me, just again how helpful it is just to see all of those initiatives set out and some of the way forward. I mean, we're seeing at the moment, even kind of as we speak, aren't we? You know, significant flu and RSV this year, and earlier than we would normally plan for. So it just shows how important I think some of this cross-sector planning is in particular. But one of the things I think is really interesting from this report is the impact of the RSV vaccinations on admissions to hospital. So we obviously monitor our admissions on an hourly, minute by minute basis, but we've also, as part of our demand and capacity planning, we take into account the modelling around, you know, expected avoided admissions from RSV and other vaccines. So it's just so helpful for us just to see some of that laid out, and that will obviously help us continue to plan going forward. So thank you.
Okay, I think Sarah.
I was just thinking about the carers often are people who should be getting vaccinations in sport, and I don't think publicity around that is reaching those right people. But we obviously run the unpaid carers contract through Carers Together Wiltshire, and we can have a conversation about how we can reach that group of people in a different way, and through our publicity would be really helpful. So
yeah, absolutely. It's definitely a group that we're aware of, and we're trying to increase that coverage, so it would be good to pick that up outside this. Yeah.
And my other question, which is a bit like random, but are we seeing more people who are, particularly young people, who are not getting their children vaccinated because of political nonsense, is all I can say. Call it is, you know, people. I know of some people who've done that, and then the conspiracy theories and all of those things, and you know, is the ways we can counter any of that to give real life examples of why it really matters.
So yeah, I think that's the work of that we did with Health Watch, looking into those attitudes. Obviously, we can look at national attitudes and things, but actually really what's happening in Wiltshire as well. And it's those pockets. And I think we often find that those people with those theories are the ones that shout the loudest as well, potentially. And with the advent, obviously, of social media as well, where are people getting their information? But I think it's a really good point, I think, that Caroline was making and yourself there, but those stories around RSV, the introduction of vaccination and the power of the effect of that so quickly is something that we can really capitalise on. But yes, young people particularly, so we are looking particularly around HPV is something that we'd like to do a bit more work on as well. Again, where are people getting that information? Is it trusted sources, and who are they influenced by? Because we know that peer-to-peer conversation and influence is the most powerful for people. Yes, yeah.
Okay, thank you very much. Any questions? Okay.
Sorry, no, it was just to say the report. I mean, you'll have all read the reports. The report is really helpful in terms of its content, and I think as a board, we must always be really assured that this work is happening and it's happening well, because health protection is quite fragmented across systems and partners as to who does what bit, and quite often during reorganisations, bits of health protection fall through the cracks. And you know, it's happened in almost every reorganisation that's happened. Part of a health protection response has not been thought about at a national level. We're really lucky across BSW in terms of our relationships with the local public health teams, the ICB, community providers, Acute and UKHSA. And so I think it's incumbent on the board to ensure that as we go through the next few years, if we need to support or help in making sure that that system stays very well glued together, that we're here for that purpose. This year, I think it's not necessarily necessary because it's in everybody's conscience, but it's a great report. It's a great partnership that works together, and it's quite often the outcomes that we don't necessarily see because it's just keeping people well.
No, thank you for raising that and highlighting that, because I think, I mean, it is all, I mean, it's all partnerships, isn't it? All of this work that's going on, but then you also need the public to join in and do their part, which is maybe the more challenging bit, to take advantage of all these things that are happening. Right, so if we move to the recommendation, which is on the screen, if I move that, do you want anybody second? Yep, so second it. Everybody in favour? That's great. Thank you so much for presenting another great report. If we move on to item 10, which is Better Care Funding Reporting, Quarter 2, which is on pages 133 to 152 of your pack. And Caroline, I think, is going to introduce this one.
Thank you. So I'll be mindful of time, so I'll just be quick. So the report is here today. It's our Quarter 2 report for the Better Care Fund, which was submitted a couple of weeks ago within the deadline. Just a couple of key points for you all to be aware of in terms of some of the key metrics that we measure the impact of our Better Care Fund. Emergency admissions, we are tracking close to our planned trajectory at the moment, so no significant variance to report, so that's positive. That's for over 65s. In terms of discharge delays, compared to where we were tracking, they are also broadly on track in line with our plan. I think it's fair to say that there is a huge amount of work happening in terms of discharges across the Wiltshire patch, well, across BSW, particularly at the moment with a real focus on the RUH, but also a continued work with SFT as well as we go forward. And certainly SFT has seen some improvements of late, which is positive. Still much more work to do. The one for us, which I think is a risk, is our residential admissions to care homes are higher than we have planned for. So that is something that we need to review and just understand what's happening there with our adult social care colleagues. So a bit of a mixed picture in terms of performance, but just to brief you on the other elements of the report. There is work, as you'll see, just to refresh our demand and capacity modelling for 26-27. So this is modelling that we do. We actually do this across the ICB as well. The Better Care Fund asks for a slightly different perspective on that demand and capacity modelling, but we are working across the ICB to make sure that that's consistent as we go forwards, but that's what helps us to understand what's our predicted demand going to be over the year, and then have we got the right capacity in place. Either that's to avoid admissions and avoid attendances at our emergency departments, or to support discharge and quicker discharge out of hospital. So that work is ongoing at the moment. Just another key headline for you. It's been widely acknowledged that the Better Care Fund will pivot slightly to focus much more on neighbourhood health going forwards. So it already does, actually, in terms of the key elements of neighbourhood health that we would recognise. So how do we support people to remain healthy at home, but also how do we put in place schemes that support people not to need to go into emergency departments, and also not to be admitted to hospital in an emergency as well, and to support their discharge. So much of that you would recognise, and it will go forward, but its perspective will change to focus more on the themes of neighbourhood health, and we'll talk a little bit about that after the break. You will see that part of the report is asking for your support for the planning approach for 26-27. So that's very much around reviewing the Section 75, which is the legal agreement that allows us to pass funding to the local authority to commission services on behalf of both the ICB and the local authority. There are 3 other phases: the demand and capacity planning, the review of the current schemes that we have to ensure they're effective going forward, and also some proposals around system learning and engagement in the new year as well. So we're planning a workshop which will help us to think through how do we make sure that the Better Care Fund submission for Wiltshire is fit for purpose going into 26-27, that it responds to the guidance, and it's also responded to the key metrics, but also where we know we've got schemes that we need to adjust and change, or even possibly stop and replace with something else going forwards. So I'll stop there and take any questions if anybody has any as well. Thank you.
Okay, any questions about the, I suppose more about the change of approach, or everybody happy? You've wowed every, oh, go on then.
Hi, I'm Emily from Great Western Hospitals, and I think just to say we really recognise that need to shift towards neighbourhood health and to evaluate the discharge, in particular the discharge support schemes that we've got running at the moment, and we've talked about that at the Swindon Integrated Care Alliance as well, and so bringing that together in the January workshop I think would be really welcome chance to evaluate what's working well, what do we keep and what do we think about changing. So yeah.
Thank you, Emily. Any other questions? Okay, so
Sorry, it was a bit rogue last minute thought. And it might be a bit me jumping the gun here, but obviously we're talking neighbourhood, a sort of that shift towards neighbourhood health. I'm sure it's been talked multiple times. We do obviously have a number of neighbourhood hospitals that are sitting almost empty. Is there going to be looked at in the future to not necessarily reopen them, because I'm well aware that they're possibly not fit for service, some of them, having been in one for an x-ray they cut off a few days ago, but maybe using them for more neighbourhood-based health care. I say this, I'd like to point out, with having experienced the HCRG's home from hospital at home over the last 6 weeks with my father, and I have to say it's been fantastic. So it's a really positive shift towards that, and there's a few things in there that small things that I'd say we could tweak, but actually overall fantastic service. But there has been times where he's had to have a few things, and it's sort of still attracted to Bath, and I just wonder if if that's being looked at in the future.
So absolutely. One of the really exciting things I think about neighbourhood health is we're starting to look at the neighbourhood health in its widest sense. So thinking also about the types of diagnostic tests that we might be able to do more locally and to think about how those can be provided closer to where people live. But the other thing about neighbourhood health is also very much how we provide support for people in their communities. So some of it is definitely about bricks and mortar, and we know that we have a number of different community settings, and we also have to think going forward about how we make best use of those community settings. And in fact, we were in a conversation a couple of weeks ago in Melksham, having that very conversation. In terms of beds, we have a number of community hospital beds at the moment that serve our population across Wiltshire. But as you've just described, we also have over 60 hospital at home beds, which as part of our planning going forwards is again one of those integral services to neighbourhood health, and one that Val can talk a lot about. And we talk a lot about hospital at home, Val, don't we? And talk an awful lot about hospital at home. So it's very popular and something that we're very much looking to grow. But there are opportunities with our estates to think about it very differently. In terms of the number of beds we have, that very much is about where is our population, how is it appropriate, how do we have the right number of physical beds, but then also how do we have the right number of virtual hospital at home beds, which is where you can have that treatment but within the comfort of your own home. And we know that by providing that support in somebody's own home, the recovery and the ability to recuperate in their own home is very different to a hospital setting, which is always very artificial. But let me hand over to Val, who might also want to talk about that.
So I was just going to kind of comment generally, because we've had a fantastic morning, haven't we? We've got the JSNA, we've got all the annual reports, which is really clearly directing us to where we need to focus our health and care priorities going forward. And I think the NHS 10-year plan of that left shift to prevention, digital, community, neighbourhood resource is really important. And it's really exciting that our contract is already commissioned to start delivering that. So I think going back to community hospitals, well, we will be reviewing as part of the estate strategy how we use community hospitals. But I think the neighbourhood health and that left shift helps us to open wider opportunities of how we use estate in its widest sense within the community, because many, particularly in the younger age group perhaps, we don't traditionally want to go into hospital, we want to access health in a much more generic way. So I think this is the opportunity to look at things in a different way, particularly with our partners, so obviously primary care, but local authority. Our community nursing teams moved into County Hall this week, which is fantastic as part of that integrated move to use accommodation in a different way. So I think lots of opportunities, but if we focus on neighbourhood, engage with our communities, which I think is what you're asking us to do, that will help to kind of drive where is most appropriate to deliver services, and where also it might be more appropriate to offer digital as well, because our younger population want more access to digital too.
Thank you. That's really helpful to know. And yes, I would agree with that. Obviously, I'm not the youngest of people. I'm by no means am I in Gen Z, but I'm only in my 30s, so you know. Digital is my big thing. My only other thing I did want to just touch on there is, as part of that, are you looking at transport to major hospitals as well? Because one of, just so people are aware, for my day job, I work for one of our MPs, and the one thing we hear repetitively is how difficult it is to get to our hospitals. You know, for someone who doesn't drive, to get to the RUH is a nightmare. You might have things like links that you can get to, but they're not always available. And I just think, you know, it's one of those areas where potentially as a county that is predominantly rural, or 50% rural, as I saw in that report earlier, I think transport here is not brilliant, and it needs a bit of joined up thinking. And I think actually if it can come at it from a health perspective, it actually puts a little bit more onus on ensuring that our transport routes are significantly better. I know trying to get into Bath, you know, you've got to get to a train station to take a train to Bath to get a bus out. It's just a nightmare, which also then forces more traffic onto the road. Just a thought. I'm sure you are.
So, I mean, just coming back, that was a really clear message when we met with the population in Melksham. And but I guess, again, if we focus back on community and neighbourhoods, and yes, we will never get away from some people needing to access an acute specialist centre. But if we put more within the community and access, we also look at the digital, you'll reduce the transport. But yeah, strategically, yes, absolutely, we need to work with our council colleagues as well in that space.
Great, thank you. And that just highlights why we do need to be considering it across the piece. So if there's no further questions, we've just got to note the quarterly report submitted to the national team, which is in the appendix in the report, and approve the proposed approach to the 26-27 BCF planning round set out at paragraph 6.2 of part 2 of the report. So if I propose that, if I can have a seconder, you can all fight again. Thank you. Everyone in favour? Brilliant, thank you very much. So there are no urgent items other than we're excited to have our workshop, which is coming on next. So I suggest that we just take a 5-minute break so people can go and stretch their legs, because it's not healthy to sit down for too long. Even, I don't know if that's in the report, anybody's report anywhere. And then so if we reconvene, if you're in the workshop at 11:40. Thank you.